It's easy to talk about, but it's important. New data from the Washington Poison Center shows an alarming jump in self-harm and suicide in children as young as 10 years old.
Health experts say all the signs in recent years have been pointing to a youth mental health crisis. Now it's time to act. Fox 13's Jennifer Lee joins us live in Seattle tonight. Jen, what do parents need to be on the lookout for?
Well, David and Jamie, in many of these cases, these young children were swallowing medication to attempt a suicide. It's difficult to process and comprehend, but there are proactive steps that parents can be taking, one of them being an open and consistent line of communication. There's troubling new data that says more than 1 million children are going to emergency departments for suicide. The Journal of the American Medical Association Pediatrics says that number has doubled in the last decade. Dr. Kira Maseth of the Department of Health Behavioral Health Strike Team says there are many layers contributing to the youth mental health crisis. A big one is the pandemic.
It's been hard socially. They felt disconnected. They may have had academic struggles. They may have been experiencing family struggles with their primary caregivers and their parents, where the parents are under stress. And so there's a trickle down into the family.
Hi, this is Teen Link. What's going on tonight?
We were there back in 2017 when phone lines were ringing at Teen Link, a peer-to-peer crisis call center in King County. In recent months, the youth services manager says there's been a spike in suicide ideations and substance abuse. The callers are also getting younger, sometimes only 8 and 9 years old. State Representative Alicia Rule is a longtime social worker and former school counselor.
We certainly have seen youth suicide, unfortunately, but the numbers and the age that we're seeing this happen is really concerning to me.
The Washington Poison Center says from 2019 to 2021, cases of self-harm or suspected suicide increased nearly 60% in children 6 to 12 years old. This past legislative session, Representative Rule was a prime sponsor of a bill that provides schools with more nurses and mental health and family support professionals.
It means that we have those trauma-informed professionals right where the children are at, which is so often in school, so that those folks will be trained in this process to be able to tell what the difference is and know how to ask the right questions and make those kind of really good referrals for families and children who might need that extra support.
Seattle King County Public Health says some of the warning signs include moodiness, hopelessness, and withdrawal, increased substance use, saying goodbyes, and a drastic change in behavior. Dr. Maseth says the healthiest step a family can take is to create a culture of communication, check in consistently with each child, and ask open-ended questions.
If you have a sense of baseline and you're checking in regularly and really asking them how they're doing, even if they're not always answering the question, you can immediately begin to see when things change.
Health experts say make sure your home is as safe as possible, and that means locking up your over-the-counter and prescription medication. They also say that families experiencing this are not alone, and it's always okay to ask for help. For now, reporting live in Seattle, Jennifer Lee, Fox 13 News.
If you or someone you love is experiencing suicidal thoughts or tendencies, please remember you're not alone. The National Suicide Prevention Lifeline is available 24/7, 365 days a year, and there are options to call, chat, even text. We also have a list of local resources on our website, fox13seattle.com. Remember, help is out there.